Hi, everybody. This evening, I'm going to be discussing some of the indications for acupuncture therapy in equine practice. So, a little bit of background to start us off. Via traditional Chinese medicine perspective, acupuncture therapy works via the insertion of needles at specific points, and this is supposed to alter the flow of energy through the body via meridians. If you're looking at it from a more Western medical perspective, these meridians loosely reflect the nervous system, and acupuncture has some measurable clinical effects. These effects include increasing blood flow, stimulating nerves, relaxing muscles, and releasing endorphins, which addresses pain. Probably the most common use of acupuncture is to address musculoskeletal issues. It works via addressing myofascial trigger points, which are those tense knots of muscle that I'm feeling in my neck right now. I'm sure you've all felt them also. It also releases endorphins, which helps decrease the pain associated with lameness or injury. Acupuncture can be used in rehabilitation following injury. This particular case was a yearling who had previously suffered a pelvic fracture and had subsequently developed gluteal muscle atrophy. We treated him with weekly acupuncture and had some promising results there. Acupuncture can also be synergistic with other treatments and can help optimize the performance of the equine athlete and also help address chronic lameness in horses that are otherwise not doing well with other treatments. Use of acupuncture for reproduction in equine practice might seem a little bit less intuitive than its use for musculoskeletal issues, but when you consider the clinical effects, which include stimulating blood flow, increasing lymphatic drainage, improving tone, and decreasing inflammation, these are all results that we'd like to see for many of our problem mares that have difficulty achieving a pregnancy. Acupuncture has been used in cases of endometritis, fluid and urine pooling. There are also protocols in existence for pregnancy maintenance for mares that have difficulty maintaining a pregnancy to term, and there are anecdotal reports for its use in transitional mares to get them to cycle. Acupuncture has been used to address poor arytenoid function. As most of you are well aware, upper respiratory endoscopy is pretty closely scrutinized in prospective racehorses. There was a 2009 study out of Florida that looked at arytenoid function in 18 young thoroughbreds aged 1 through 4. They addressed it via weekly acupuncture treatments, and it improved scope grade in all 18 horses. A few additional indications: cryptorchid colts. Acupuncture has been used with and without the aid of other pharmaceuticals to help help encourage the descent of inguinally retained testes. And also in cases of laminitis, acupuncture has been used to improve comfort in chronic cases. So there are lots of indications for acupuncture, as I think we can appreciate now. It's definitely not a cure-all, and most importantly, you should never ever let acupuncture interfere with appropriate medical or surgical treatment. That said, it is surprisingly well tolerated, even in young or fresh horses who you think would not tolerate it very well. You can see synergistic results with lots of your other treatments that we're already using. It's very safe. There are very few adverse effects. And it may be beneficial when other treatments are insufficient or ineffective. In short, it's another tool that we have that can help optimize performance and improve comfort in our horses. Thank you very much.